everybody. I'm Chuck Schulte. I'm going to be doing the shoulder pain and the rotator cuff workshop today. It's not quite start time, but I just wanted to come up and kind of get to know you guys a little bit before I think we maybe have a couple more people that are still coming. So we're just going to hang for a few minutes. So how's everybody doing today? So who's got shoulder pain? Raise your good arm. And so some people will raise their arms. Okay, all right. And so who maybe is a spouse or a partner that has shoulder pain that maybe got drugged here by their spouse? And somebody maybe raised their hands on that, maybe not. And you can even say, don't worry about raising your hands, but the workshop is a great opportunity just to get some more information. That's what we want to get for you guys. We want to get you some information so that you can figure out what's the best decision to help you with your shoulder pain. We've got a worksheet. It's in your folder. If you want to go ahead and pull it out, it's some certain color. I'm not sure what it is, but you can tell them that at the time. And so we're gonna go through the workshop, through the worksheet. If you want, you're certainly welcome to fill out the lines. I'll be giving the answers if somebody doesn't figure them out for us. And so these are just kind of talking points, so we'll kind of expand on those as we go. But I had a question before we really get started, and that is, what kind of things makes your shoulder pain hurt? And so people will start sharing some things, and so they'll be throwing them out kind of left and right, and you can write them down. So maybe they've got reaching. You want to try and get them a little more specific. Maybe in the back of the car, or maybe in the cabinet and things like that. Somebody may mention dressing, they're sleeping. So just kind of try and get some things from people that make their shoulder hurt. And that way people around, everybody in the group starts to see, oh, I got pain with that too. And so it starts to create a little unity of the shoulder pain club. So as I said, we're going to be going through this worksheet, and it is just about time to start. I think we've got everybody here, so we're going to get going. So formally, welcome to the Diamond Physical Therapy Health Fair and the Shoulder Pain Rotator Cuff Workshop. I'm Chuck Schulte. I'm one of the physical therapists here, and so we're going to get started just by starting right at the top, number one, where it says, what is the rotator cuff? So your rotator cuff is a group of 4 muscles that help to control your shoulder. It's a ball and socket joint, and so it fits like this, and those muscles help to control and keep that joint lined up so that when you move and do things, everything moves smoothly. So there's 4 areas that kind of affect the shoulder, and they are the neck, and the rib cage, and the shoulder blade, and your collarbone. We're going to talk about the neck and the rib cage a little bit more later, but so here's a diagram of the shoulder. So this is your shoulder blade, and you're looking at this person from behind, okay? And these guys are the bones in your neck and in your back. And your rotator cuff has 4 muscles. We can see 3 of them from the back. One of them is here, one of them is kind of in the middle of your shoulder blade, and one's down here. They all go up and attach to your arm bone, up by the ball part of that ball and socket. And those muscles help to pull and keep that joint lined up. And so when things happen to these muscles or other players, like the neck and the rib cage and some of those things, that's where you get shoulder pain. So that is all the anatomy lesson I'm going to give you. So it's all really pretty straightforward. I want to keep it simple so that we can really get down to finding the cause of your pain and then showing you how we can fix it. So before we get going with that, one question might be, who is Chuck Schulte and why would I want to be listening to him? What does he know about shoulder pain? I'm a physical therapist, and way back when I was in college, I played baseball. And I was a pitcher, and after a year or so, I became a member of the shoulder pain club and started spending more time in the athletic training room than I did out on the baseball field. And that was pretty frustrating, and I wanted to try and figure out how to fix my shoulder. So not only kind of being a patient when I would go to the training room, I wanted to learn more about it. So actually I started working in the training room as a student trainer, and that started to sort of fuel my interest, particularly in my shoulder, because I wanted the Yankees to call me. But unfortunately that never happened. That's why we're having this conversation now. But all those things that you talked about that cause you pain, I know exactly what you're talking about. I've been there, and I want to help you figure out how you can get out of that. So enough about me. Let's keep going on the worksheet. So this next number, number 3, the first step is the pain in your shoulder reproducible? And so I guess the question is, what does reproducible mean? And reproducible actually means a bunch of these things. If you do something that makes it hurt. In physical therapy terms, we call that mechanical pain. Because you're moving something, and if your rotator cuff muscles aren't working right, then it doesn't keep that lined up right, and things can pinch and rub and cause pain. So if you're somebody who, let's say, we've had folks come in and say, oh, my pain is like a 5 out of 10. It just hurts all the time. Really? Yeah. So does it ever get worse? No, not really. Does it ever get better? No. And I take them through a bunch of motions like that, and no, it's still 4 out of 10. No, that doesn't make it hurt more. It just hurts all the time. It just hurts the same. Then those folks actually aren't a very good candidate for physical therapy. And if by chance, over the course of this workshop, you kind of discover that you're maybe one of those folks, I want you to come talk to me after the workshop, because I want to give you some ideas and some things that you can be doing to figure out what that pain is caused by and to get the help that you need. But if it's reproducible, and it's one of these things, as therapists, we know what muscles are working, what joints are moving and getting pinched or stretched and things like that. So we can kind of reverse engineer and figure out what the cause is. And if it's reproducible, then that actually means that it's also reducible. We just have to find the cause. When we find the cause, we can put those two together and we can get you back to feeling good. So, in the last 30 days, what kind of pain have you had? So we've got some stuff up here. Has anybody come up with anything else? And if they haven't come up with anything else and there's a couple that they missed, that's a time just to say, so does anybody have trouble, putting their bra on? And probably get a hands and so that you can throw that on there, or anything else that you think is a good example that people missed. Okay, and so that sort of involves what were you doing and what happened then, okay? And so now we've talked about things that they do that create pain. And so now it's time to get somebody up for a demonstration. So typically what I say is, okay, so we've got a lot of things that cause pain, and all those things are the reproducible things. So let's do a little test. I want everybody to stand up for a minute, okay? And I want you to lift that arm that you're having trouble with up over your head. Now I always demonstrate it so they know exactly what I'm talking about. And as you're doing that, you're looking for people who are having trouble lifted. Actually, I kind of like to look for people who don't grimace until they get to the top. Those people are a little easier to fix in the short term. And you can do some other movements as well, but this is usually the one that I'll use. And I'll say, okay, so who has pain doing that? And the people who don't have pain doing that, okay, thanks. Why don't you guys sit down, but I want the rest of you guys to stay standing. And the other thing you can do is you can check for rotation, side bending. We're looking for a first grip person. Those are really great examples. If you can't find one of those, you find somebody with some pain, sort of at the top, and you ask them if they'd like to come up and be part of a 5-minute miracle, and maybe we change their pain. So they come up, you do a really brief history. The one thing that you don't want is you don't want anybody who's had a previous surgery, because that's kind of a mess. So as you're narrowing people down, and you say, so tell me about your pain, And if they're a good candidate, they'll tell you about it. I said, so have you had surgery at all? And if they say yes, I go, you know what? I'd love to talk to you afterwards, but the surgery patients are a little trickier and we don't quite have enough time, but I'd love to give you that time afterwards. So is there anybody else who blah, 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 and then you get them up. You take a brief little history in front of them, and then you take a look and you decide what you want to do. I've got here, the first rib, that first rib mob is kind of the best one if you can find somebody like that. You do that, and I put them on the sheet so you can look at those. And then you're just doing a brief, a test, a treat, and a retest. And as soon as you get somebody feeling better, you kind of play that up, you congratulate them, and sort of quit while you're ahead, like I wrote in the notes. And once somebody sees how fast you can change their pain, then they have your attention for the rest of the talk. So you thank them, you set them down, everybody's happy, and so then we go into shoulder pain. And what's the biggest single mistake most people make with shoulder pain? And actually, it's probably the biggest mistake that people make with any problem. And they'll throw a bunch of things out. Sometimes they get it with ignore, and sometimes they don't. So if you've gotten 4 or 5 guesses and it's not quite what you want, then you can just kind of say, what do you think about ignoring? Do you think that's a big problem? And they'll usually say yes. So basically it's getting them to acknowledge or see that the biggest problem you can make is to ignore it. So can anybody think of a problem that if you continue to ignore it, that it would get better? Most people agree with that. Okay, so how about ignoring a problem for a really long time? Doesn't that normally get worse? And people will say yes. You can even ask somebody for an example if you want. We want them to recognize that ignoring it just makes it worse. But so why do people ignore it? And some people throw things out. What you're looking for is that they feel like they have no control. You don't have any control over that problem. I've done all these things and it's not fixed it. So I just don't have any control. They're kind of hopeless. And I just have to live with it. And sometimes people will share that, well, the doctor told me I was just going to have to live with it. And they believe them. So we want to get ignore and that stuff out of them. So the other thing you can do when you've got a problem is you can try and alter it. So for shoulder pain, how do people alter their shoulder pain? And we're looking for people to mention medications. If they don't, if somewhere along the line later, or they don't, somewhere we want to get injections listed up there too. And then maybe somebody will actually suggest that, well, I just stopped doing things. And here's an interesting little thing you can do with that. And that is, yeah, so you stopped doing things, right? What'd you stop doing? And they'll tell you. Say, so here's an example. If we took a square and we put a bunch of squares inside it, and this sort of represents all the activities that you do. And on the outside is the really heavy stuff. So maybe it's that 40-pound bag of water softener salt. Maybe it's carrying groceries. And some heavier kind of things like that. And the things that are inside are not as strenuous. So maybe it's reaching in the cabinet. Maybe it's washing hair as a physical activity. So now, as that problem goes on, and maybe you're in that category where you're ignoring it, if it hurts to do the 40-pound bag of salt, you probably stop doing it, right? Yeah. And maybe you don't carry the groceries anymore, or maybe you only carry one at a time, or you've changed that, or you've just stopped doing it. And as time goes on, that problem is going to get worse, isn't it, as you continue to ignore it? So now reaching in the cabinet starts to hurt, and you stop doing that. Or washing your, boy, maybe you're doing it, but it just kills you to wash your hair. So as time goes on, less and less, you're doing less and less things till you get in this middle square where you can't really do any of the things that you want to do. And actually, I like to call that, you stop living and doing the things you want. So it can take a really long time for somebody to get to there, maybe years, but we can still help people in that box if too much damage hasn't happened. But I guess my point for you is this: it's a lot of work to get all the way from there to there. Boy, it's not nearly as much work to get from here to there. The longer you ignore it, the smaller the box you get in. So those are the two things that most people do when they try and alter their shoulder pain. They do medications, they stop living. You know, maybe they're using some ice and things like that. But does any of that address the cause of the problem? Most people recognize that it doesn't. Exactly right. So that's the third thing that you can do with any problem. And the first one is ignore it. The second one is try and alter it, but that doesn't really fix it. And the third one I like to call is to handle it. Which means find the cause. And when we can find the cause, it gets fixed. And it gets fixed for good. So we're going to talk about those causes next. Ugh. We need to be sure to have one of these on Saturday, right? So the big thing when you're doing these is to use very, very normal vocabulary, nothing special. And in fact, some of the stuff that we try to draw isn't even anatomically correct, but they just need to get the concept. Okay, so now we're going to talk about the three most common causes of shoulder pain. So if you look there, it's right there with number 6. And one of them is a problem with your neck and your rib cage. Personally, I'm not a good enough artist to throw neck and rib cage in this picture, so we're just going to kind of talk about it. But you do have muscles. See, we have these muscles in the rotator cuff that go over to your arm bone, but we also have muscles from the shoulder blade that go over to your spine and then up to your neck. So did any of you notice when you're lifting your arm earlier, or when you do have shoulder pain, you go to lift your arm, sometimes it does that. And that's some neck muscles pulling on that shoulder blade to try and help you lift your arm up. That can make these muscles hurt, and it throws off all that really nice alignment that those muscles are supposed to be doing to keep your shoulder joint lined up. So that can make your neck hurt, and some of those muscles are actually attached to your ribs, which I have not drawn in here. And that can pull on those. So we're gonna be talking about how we can fix that too. And if you had a first rib person in the 5-minute miracle, you can sort of reiterate that. So that was a problem that Carol had. Remember when I was pushing on her like that? I was pushing on one of those ribs, and boy, all of a sudden it makes your shoulder feel better. So all those things work together. The other kind of problem is called impingement. And impingement, again, means that shoulder's not rolling around the way it's supposed to, and things get pinched or impinged. That could be from lots of different things. It could be maybe these muscles are injured. It could be because some other muscles are tight, and that can cause pain as you move. That's that reproducible stuff that we talked about. And then the last problem is poor posture. And that can affect how your shoulder works too. So here's what I want everybody to do. sit nice and tall for me, and with your good arm this time, lift it up as high as you can. Okay, great. Now here's what I want you to do. We don't do this very often at Diamond Physical Therapy. I want you to slump. And they slump way down in their chairs. I said, okay, so you have to stay slumped, and now I want you to lift your arm up, and they're only going to get to about there. So, wow, posture has a lot to do with how you can move your arm, doesn't it? And some of them will probably begrudgingly agree to that. And so there are lots of postural things that we can do to help change your pain. So, as you saw with Mary when we did that demonstration, we were really able to change her pain fairly quickly. Now, just that by itself isn't going to fix the entire problem, but she had reproducible pain. As a physical therapist, I had an idea as to what kind of things were causing that, so I went to affect them a little bit, and we could change her pain and we could change her motion. So that's how we can help folks with shoulder pain. So that kind of leads to the question of, what does that question lead to? Oh, yeah. So what does successful, non-surgical, no medications, no injections kind of treatment involve? And here's basically how we help you with that. We do something, one of the things we do is something called hands-on physical therapy. And that's what I was doing with Mary earlier with her shoulder pain. We're moving things that you can't move on your own to help line them back up and to get them working the way they're supposed to. The other thing that we do is exercises primarily for strength, to build those muscles up so that they're better at moving you effectively and keeping everything lined up the way they're supposed to. We also like to have people involved, and we can't do it all on our own. So you're going to get some homework from us so that you can be working on this problem on your own on the days that you're not here. And then lastly, some things we've been doing for the last year or so is one of them is called laser therapy. And we are actually doing free laser therapy treatments today. So if you want to sign up for that before you leave, it's a great chance to get an opportunity to see what that's all about. Laser therapy is great for decreasing pain and inflammation. And the faster we can get your pain under control, the sooner we can get to some of these strengthening things so that we can fix that problem once and for all. Something else that we're doing that not a lot of people are doing is something called dry needling. We're actually having a presentation later today at 2 o'clock. This is going to talk specifically about those two things, so I don't want to eat up a whole lot of time with that. But those are some options as well. So, trick question for you guys. Who would like to still have shoulder pain? Yeah, I didn't think so. All right. So who here has shoulder pain and they want to find out what the cause is and fix it and just get started with physical therapy right off the bat? Okay, so raise your hand, and I demonstrate and get them to raise their hand. I say, okay, great. So I want you to stand up. Some of them will be resistant, so you say it's okay. Just go ahead and stand up if you're having shoulder pain and you would like to get started with physical therapy and get this handled. Once they stand up, say, okay, so here's what I want you to do. I want you to go walk over to Sue and Maria, and they can help you get scheduled for an evaluation. Now, I'm going to be here all day, so if you have any questions, you can still get them. You still get them answered by me. But everybody who wants to get started now, go ahead over to Sue and Maria, and you let them get over there. And then you say, okay, so who has shoulder pain but still isn't quite sure that physical therapy is the answer for them? And you'll get some acknowledgments, and you get some people just kind of looking at you like that. And so here's what I like to do to help you sort of figure out if that's the case. We don't do this a lot. really pretty much we only do it on these special occasions, events like this. But what I'd like to offer you is a free discovery visit with myself or one of the other therapists here, where you can sit down and talk with them, and they will help you determine what is the cause of all those things, what's the cause of your pain, and what's involved in getting better. Now, here's the catch with that. We need to get that set up today, because we've got a bunch of people signing up for evaluations. We've had some foot talks and some back talks. So our schedule is going to be filling up pretty quickly. So the sooner you decide to do that, the better. So if you can sign up for a discovery visit today, then we can help you figure out what that is. I haven't done one of these for a while. Yes, so we can help you. We can help you figure out what the cause of your pain is and what makes it better if you sign up for one of those. But today is really going to be the time you need to do it, because we're going to be filling up very quickly and the waiting list is going to be really long. So, who would like a free discovery visit? Raise your good arm. And some of them will raise. Okay, great. So come stand up. All right. So those of you guys who want to do a discovery visit, go walk over to Sue and Maria, and they can help you schedule. Listen, you guys, this is completely free. We've tried to take all the risk out of it. Honestly, I think you're crazy if you don't go get a free discovery visit, but we'd love to help you with that. So go talk to Sue and Maria, and they can get you set up for that discovery visit. And those folks will walk away. And the rest of the ones who kind of don't want anything. So that's when I say, so does anybody have any questions? Because maybe you haven't addressed those. They'll throw some questions out at you, and that's basically it. So, hey, thanks for coming. If we can help you in the future, please don't hesitate to call us. You guys have a great day. Thanks again.